Hi, Dr. Lisa. What a pleasure to have you here. Welcome.
Awesome. Thanks for having me. I appreciate it, Minesh.
Good. So, most people may not know what you do, and I'm your client, obviously, patient, whatever the technology terminology might be, right? And I'm very grateful that there are people like you who have dedicated their time, their service, their expertise to help people. So, most people may not even know what you do. So, do you want to share what direct primary care is and how people can benefit from it?
Absolutely. Yeah. I've been doing direct primary care since 2015. I worked in the rat race for a long time, seeing 30 patients a day, doing labs at night, not going to the bathroom, couldn't eat lunch. I lived that life and realized that is not what I went to school for. And as I learned more about holistic medicine and preventative medicine, I realized the 7 minutes I had with a patient was not going to be enough time. And I was just writing prescriptions. I didn't feel like I was helping in a way that I could. Like I had the potential to really help a lot more than I was able to in that environment. So in 2014, I learned about direct primary care, opened a practice in Gainesville with a business partner, May of 2015. And direct primary care is different in a lot of ways. You're not a number at the office. Everyone knows you, right? We don't rush patients through. Everybody gets an hour. And we know some patients have higher needs. They get a longer time, some people less. So it's very personalized. We listen, right? We're on a journey together. I'm not telling you what to do. I'm guiding you. And in a more holistic way. Do I write prescriptions? Yes. Do I have a pharmacy on site? Yes. But my goal would be for you to take the least amount of pharmaceuticals possible for whatever conditions you have. So I'm going to talk to you about nutrition and sleep and exercise and grounding and sunlight and what you're doing for fun and all these other things that impact your health that most healthcare providers don't have time to discuss. I love what I do. I get lots of time with my patients. They become like family. You come into our office and people usually sit on the couch and chat even after their appointment's done. So we made it a very welcoming and fun environment. Where a lot of people, you go into the doctor's office, and I had been out of the healthcare system for a while and then had an injury and got thrust back into it. But sitting in a lobby, full of people, you're a number, nobody knows you. You sit in a room, then after you wait in the lobby, then you sit in a room for however long, and then you get 7 minutes, right? Don't ask too many questions, and please don't come back anytime soon. Like that's the feel, right? In traditional medicine. And it's not the provider's fault. I don't blame them at all. Like they don't get into medicine to treat people like cattle. It's just the system and how broken it is. So, for a low monthly fee, you get the time you need. There's no copays when you come. Some people's copay is more than $60. And that's, this is where we start at for monthly membership. So I just feel like we can do a better job when we have more time with people and help them reach their maximum health as opposed to treating them like a number. And, I'll see you in 3 months and here's another prescription.
And I totally agree with you. So, one of the misconceptions people have, which is really strange, but because of the media, because of the buzzwords in the spread around, people confuse health insurance with health care. Do you mind sharing a little bit about that?
Sure. I like to say, you have a card but no care, right? You have an insurance card and I'm paying for insurance, so I want to use it. So my response to that is, well, you pay for car insurance. Are you running into a tree so you can use your car insurance? Or, oh, you have homeowners insurance. Are you going to put your house on fire so you can use your insurance? Like insurance is meant to be used for emergencies, for urgent issues, right? And with health insurance in the middle of primary care, that's your maintenance, right? That's your prevention. Like your car insurance doesn't pay for your oil changes or your tires, right? It pays for accidents and major things that happen. So the reason healthcare is so expensive, primary care is 80% of what happens in healthcare. And I can take care of that at my office. And I want people to have insurance or something, excuse me, for catastrophic stuff. But for your day to day, that should be handled in an environment where it's prevention and slower pace and let's look at all your numbers and let's keep you out of the healthcare system. Another thing about primary care and traditional medicine is they're going to send you to 6 specialists. Like they don't have time to deal with your stuff, right? So you're going to come in, they're going to get labs like, oh, this lab's abnormal, go to this doctor. Oh, this lab's abnormal, go. It's like if you just sat down and talked to somebody for 5 minutes, you can fix half of those things with nutrition and sleep and exercise and stress management. But they don't do that. They send people on wild goose chases, and half the time they don't get the follow up they need. You have a card sorry, somebody keeps calling me. You have a card, but you don't have any care. I mean, we put the healthcare back in healthcare, right? It's the care piece, not a card. And I don't know, I mean, we have been, since the HMO has been indoctrinated to believe that we have to have this insurance and da 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 da. And for most healthy people, you just need some kind of high deductible plan or healthcare sharing and a good primary care, and you're not going to utilize the healthcare system. You're just not. You're going to stay out of the ER, urgent care, all that stuff.
Exactly. And I must admit, personally, I didn't know the difference initially as well. And it's like the moment you have health insurance, you're like, I have health insurance. But it's not health care. And I think you gave a great example of oil change versus an accident, right? Most people need oil change done, right? To some degree.
Yeah, and
right?
they don't. And then they overutilize because they end up in the ER with something that could have been prevented 5 years ago, but they've never had a primary or didn't go, or it was a hassle. Or men are the worst. They go and then they never get their labs, they never follow up. And it's like, when I get a guy in here, oh, you're getting everything when you're here. You're an EKG, blood work, like whatever we can do while you're in house, we're going to do all of it, because we know men in general just don't seek care. And so, I want to keep them healthy. I usually love their spouse more than them. And I want to make sure they're around a long time, with their family. So yeah, so I'm obviously very passionate about what I do, and I appreciate the opportunity to get to take care of people.
Well, exactly. And that's exactly what I think the people need to understand is you need to go to the gym regularly as an example. That's what direct primary care is teaching you to do that, is you
Right.
have more focus on prevention. And the way you do prevention in terms of your car breaking down more often is you get the brake pads checked regularly, the tires rotated regularly, you get the oil changed regularly. So the car doesn't break down, and the body, in the same analogy, doesn't break down because you have been focused on the prevention part of it and actually taking good care of the body. And hence, you're
Right.
going to be in a much better health. And that's why I'm pretty much anti-health insurance as a concept in general. I don't mean people shouldn't have catastrophic insurance. That's not what I'm talking about. But the over-reliance of health insurance has brainwashed people into believing that health insurance is more important than health care, whereas health care should be more important than health insurance, because health insurance is the last resort when nothing is working. You have an accident, boom, you will need health insurance at that time, most likely. You have cancer, you'll most likely need something like that. But
100%. Mm-hmm.
on the other side is if you did the right things long enough, those incidents are less and less likely, less frequent.
Especially the lifestyle ones, like the diabetes and the heart disease. Like, I can coach you and change your life, literally. Like, I can help you, if it's weight loss, I can help with weight loss, whatever it is, exercise, accountability, just having someone to talk to, getting you to counseling, stress management. Like, I can prevent all that stuff if people come and they let me help guide them, right? Like, I tell people, like, I am, like, you're driving the bus, but I'm sitting right behind you in your ear, recommending things and encouraging you. And you just don't get that in traditional primary care. You get like nothing.
Absolutely.
2 minutes.
And
The last
I'm in
time I went to
agreement.
the primary, it was like, I forgot how bad it was because I had been in my own practice for so long. And after the spinal cord injury, I had to follow up with the primary for something for the insurance. Oh, so I could get my PT for insurance. So I had to go to the primary, who is a nice guy who I'm a friend with. It was terrible. I sat in the lobby for 25 minutes, somebody's coughing on me. And then the medical assistant didn't even hardly speak to me, took my vitals, sat me in a room, had no timeline concept. And I just sat there, and then he was in the room for literally 3 minutes, and he's like, yeah, oh, you have to be here for the insurance, right? That's how they get you in too, because they can't bill by texting you or emailing you results. So you have to come in, they hold all your stuff hostage because they want to build the insurance again, not because they want to see you. I mean, nothing personal, but you know what I mean? It's like imaging and so many different things. Like, I want an MRI on somebody, but I can't get an MRI through insurance unless they do an x-ray. I don't need an x-ray. You didn't break a bone, but I can't get the insurance to pay for an MRI until I've had an x-ray. So I'm going to expose you to radiation. No, you know what? Your copay for your MRI is going to be $500, but I can get you an MRI tomorrow for $300 outside of your insurance. So no, you're not going to get an x-ray because I don't need you to get that radiation because I know it's not broken. Yes, we're going to get an MRI tomorrow for $300 outside of your insurance, and you saved $150. How is that a thing? It is real every day. It's so crazy.
Yeah, we don't want to go into the politics of insurance system because you would get me started and I couldn't stop. Because I'm very familiar with what goes on. Unfortunately, when people are aware like me and you, we know the system is not designed for the customer. the system is designed to keep the money in the system for those people who are funding
Keep
the
people
system.
sick. It's sick
Exactly.
care. It's not healthcare.
Exactly. And they don't make money if you are healthy. They make money when you are sick and need help. So let's talk about a little bit about your background. What prompted you to even start in this journey?
How far back you want to go? Okay, it's a long journey. So I started out actually in my early 20s as a respiratory therapist. And I can't work in systems. We talked about this last time. I am not a good employee. I mean, I can make you a lot of money, but I'm a total pain in the neck because I don't like inefficiencies. I don't like micromanaging. I don't like any of that stuff. So I worked in the hospital system as a respiratory therapist, not a hospital system girl. So ended up in a small business that did like home ventilators, CPAP machines, feeding pumps, all that kind of stuff. Then I opened an office for another location that specializes in pediatric respiratory therapy. So I was like the expert. If there was a ventilator going out of Shands Hospital, I was the only person that was allowed to touch that patient. Like I became the expert, which was fine and fun for a while. But I'm like, I could do so much more. Like I have capacity to do more than this. And so I always want to be a nurse practitioner or a PA or something. I looked at medical school. That didn't seem reasonable with a family. I'm glad I didn't because I really love being an NP and having the holistic approach. So I went back to school when I was 29, got my first bachelor's at UF in health education because I wanted to do the accelerated nursing program and you had to have a bachelor's degree. And I only had an associate's with my respiratory. So in 2005, I graduated with my nursing degree, but I never got a job on the floor at the hospital because they knew they wouldn't have me but a year and a half because I was going to grad school. I ended up, because of my respiratory experience, worked in a pulmonary lab as their nurse. So I did all kinds of like asthma studies and just, again, in a system, not made for a system. I get out, I go straight through with my nurse practitioner and I worked in a lot of different jobs because again, I'm a slow learner. I did really well and I did really, really well with running my own medical equipment company and being an expert. Like I do very well autonomously, right? Where I can make an impact and I hire the people and I can, help grow it in that way. And my boss was not a micromanager. He was great. But I had this longing to do more. So I ended up in school, went through all the way to get my doctorate, started out in pediatrics, realized I can't help the kids if I can't help the parents, went back and got a postmaster's in family. So I'm dual certified and then got my doctorate in 2010. And then I worked in all kinds of different environments because I love learning. I get bored, I did specialties. That is not right for me. I'm like, yeah, I did hematology, oncology, I did primary care, peds and adult, I did child abuse, I just did all kinds of things just because I enjoy learning and, I love people and how can I help? So saw direct primary care like as a practice model in 2014. And I was like, and me and a friend of mine went to grad school together. And so she and I started that practice in Gainesville and ran it for 7 years. And then she bought me out and then I opened over here. But it was just a different way. It was about creating an environment where people felt safe, where they knew that they had a voice and that we would listen to them. I mean, people would just sit and cry like, nobody's ever listened to me. Nobody's ever given me more than 5 minutes. And it's like, and I had one girl in here, she's like, you've helped me more in 30 minutes than 7 specialists over the last 10 years. And it's not, I didn't do it. I'm not magical. I have no powers. Believe me, I don't. I just listen and, I take in clues and I'm like, have you tried XYZ or what about this? And they're like, oh, well, nobody's ever said that to me or no, and I'm like, how, and even today I had a new patient and I can't believe she sees 4 different doctors and they have her on all these different medicines. And I'm like, okay, has anyone listened to you? Has anybody like put all your stuff together and had a conversation with you? Like, you shouldn't be on this with this. And why are they like, I don't understand. Like, that's what happens in traditional medicine, right? You have 7 silos and everybody's ordering meds and no one has the time or energy to deal with all the other things. And so you end up on meds to counteract the effects of other meds. Like, no, it's like, here's your complaint, here's a script. Here's your complaint, here's a script. Now we're not going to find out if this complaint is from another prescription. Why would we do that? That's silly, right? No, we're just going to order something else. Oh, so frustrating. I hate it for people. They run around and they're on all these things and they don't know why, and they still feel like crap.
I totally agree with you because to me personally, and again, I found out about direct primary care, I think about 2007, 2008, especially when they were pushing the entire country into an insurance program, right? That's when I was like, okay, what are the other options for the average person? Because just to be honest, I mean, insurance is too expensive for the average person. It's just too expensive for the ROI that they get. It just is not feasible.
Right.
They pay much less for somebody like you, who they have much better access to. You know? And I think
100%.
that's the most important part. Whether you need life insurance or not is your personal situation, but having somebody like you that they can interact with anytime they have a situation, or at least even if they have a question, even if they have nothing that is wrong necessarily, but they want to get clarification, they want somebody who understands, listens to them. So I really appreciate the service you provide to people. More people should be using your service for the very simple reason is you're going to fall sick less.
Right.
Employer, it makes so much sense. An employer who's paying for health insurance doesn't realize that you are, in your example that you just gave, you are encouraging people to fall sick to use health insurance, right? Which is the card. On the other hand, the health care is the component. If you become part of the integral part of the company, the employees know you, the employees come to you regularly. The employees are going to be less sick, less days off, and they're going to be not having to wait for an emergency to go to the hospital for that matter. And if the company doesn't provide health insurance and the people don't have health insurance, guess what? You can be a very good option for the employer in order for them, the employer, to provide an added value.
Oh, for
It's
sure.
very inexpensive compared to the health insurance, but more important, they know their employees can focus on being healthy instead of waiting to fall sick to go use the health insurance card. Is that fair enough to say that?
Oh, 100%. Yeah, we had in our practice in Gainesville, we had over 220 businesses enrolled where their employees could come, and if their employees were kind of younger, we could help them with, getting for women, getting their pap smears and their birth control and that kind of stuff, and for men, especially like, we would talk to them about family history. Like your dad has been on blood pressure medicine since his 30s. You're 29. Let's talk about some health things we can do to maybe prevent that or push it off for 10 or 15 years or whatever. Yeah, there's so much value in that. And, this last year and just on New Year's Day, I kept 3 people out of the ER. You don't want to be in the ER on New Year's Day. Like, let's find a pharmacy. You've got a little GI bug, or, you've got this little skin thing. We'll get you some antibiotics or whatever. But people like, you wonder why these little ERs and urgent cares are popping up everywhere because nobody can get in their primary. So it's like that. I mean, that's the reason you're like, oh, they're overutilizing the ER. Well, where else are they going to go? They can't get in their primary for 3 weeks when they're acutely ill. What is that? How is that a thing? And then for us, I mean, with me, it's same day, next day. I mean, like text me and I'm going to take care of you right now if I can. And if not, I'll get you in the office and we'll get you taken care of today or the next day. And people just don't understand the value in that. Like until they're what ends up happening is somebody's in the system and sees how broken it is. And they're like, oh, I should have been going to Lisa all this time. And it's like, yeah, you should have for sure. It's like, but they're like, but I'm paying all this money for health insurance. I want to use it. I'm like, okay, makes no sense to me. Sure, you can be caught in the system and end up at the urgent care 3 different times and 45 phone calls. Your time is obviously not very valuable to you. Okay, I don't want to do that. No, thank you.
Well, those who are watching, listening, just remember, focus on health and not falling sick, right? So if you
Right.
fall sick, you have to go to the hospital system, typically speaking, right? On the other hand, if you can go to somebody like Dr. Lisa, who's a direct primary care provider, she has all the qualifications that you would need in order to help you, support you. And if she doesn't, she'll guide you to the right person as well. But now you have access to somebody who can focus on you being healthy rather than you waiting to go to the system when you are sick.
Take care. Yeah.
That's really the crux of all that. Good. What else do you want to share about your journey, your story about this, what most people don't understand fully about direct primary care? Is there anything we missed in communicating to people?
Yeah, I mean, there's cost, there's time. We have a wholesale pharmacy here. So if you needed antibiotics, you can get them while you're here. I think it's just the healthcare system's a hassle. Like this is the easy button. There's no hassle. You call, we answer, you text, I answer, you need something, I take care of you. People come and they're like, is this real? Like, really? I'm like, yes, it works. I've done this for a long time. Like, yes, it does. Don't be afraid to try something new. Come in, we'll do a consult with you for 30 minutes. I can't give you medical advice, but I can tell you about how the practice runs and if you needed something, and just get a feel for the energy here. We love taking care of patients. It's very personable. Yeah, I just feel like it's such a good experience. And we just do a lot in-house. Like I don't send people out for everything. I do IV therapy here, and we do weight management here, and we do hormone replacement here. And I have a machine that helps with a non-invasive machine for chronic pain or acute injuries. I know people don't follow up and don't go if you send them 7 different places. I try to do as much in-house so that they don't have to run around as much. So they have a safe place where they know. Because if you have a good primary, you're not afraid of the healthcare system, and you're not afraid, people are running around. They have a lot of health anxiety, especially with the news, right? They have a lot of health anxiety. They don't know how to maximize their immune system. So they're in this fight or flight all the time. They don't have enough vitamin support or whatever. And then they end up sick all the time. And then they're overutilizing the system. I'm like, let's get your immune system strong. Let's get you on some high dose IV vitamin C, 2 or 3 of those, along with your vitamin D up and your B12, and make sure you're like all of these things are maximized. And then you're not going to get sick, right? I'm sorry. I'm just passionate about it. I just feel like I wish everybody would come here and get care so that we didn't overutilize the system and people's time was more valued, and, they stayed healthier longer.
Well, I totally agree with you, which is why we are going to promote your interview to as many people as possible.
Love it.
Thanks. Good. So I appreciate you taking the time, and I look forward to seeing you in person in a few days, because obviously we belong to a networking group as well as I'm your client. So I'll get the opportunity to see you shortly.
Yep. Looking forward to it.